Everyone, you are welcome to MEDx. Today we are diving into a race that most people have no idea what is even happening. So it's not about Apple versus Google, US versus Europe. It is China and India. So these two countries, over 2 billion people, and digital health so down that it is moving fast. So stick with me, and by the end of this video, I'm sure that you're gonna see these countries completely in a new way. In current scenario, globally, healthcare is under pressure. People are living longer, but there are not enough doctors who can provide, specialized services, who can provide the quality services, quality care to the people, right? And the healthcare is also getting more expensive everywhere. We all see that, right? So, what about digital health? So, it's not just something nice to have anymore. It's the only way forward now. Why? Because AI is doing diagnosis, telemedicine is connecting doctor and patient together, right? And even smartwatches tracking our health. We all know that, right? So, honestly, China and India are way ahead of the curve, right? But here is the interesting point. Both of these countries are doing it completely in a different way. So let's break it down country by country. So let's start with China. China has a huge plan in digital health that is called Healthy China 2030. China is moving fast, taking big decisions on digital health, and it has also the full support from the government side for anything that is digital, either it is AI, artificial intelligence, robots, or smart hospitals, all of it. And we can also see the example of advancement of digital health in China. When we walk into top hospitals of Shenzhen or Shanghai, we can see AI is scanning the lungs of the people, right? And robots are delivering medicines. So one of the important part while diagnosing the patient, that is the history taking, right? But in China, in such hospitals, in such top hospitals, in I have given the example of Shanghai, right? When you walk into those hospitals, medical history are already on the screens. So before the doctors arrive into the rooms to meet with the patients. So let's take a step back for a second. So all of it connected, digital and fast. So that is the power of central control and deep bonding. Now it's time to look at India's strategy. So India's strategy is totally different, but it is powerful, right? India's healthcare system is spread out, especially in rural areas, because there are fewer doctors. And that is the big challenges. But that's why India is becoming the hub for smart and low cost innovations. Many entrepreneurs, healthcare entrepreneurs, they develop the apps that can be run without having internet access, and many AI have been developed that can run even in a cheaper smartphones and telemedicine booths in remote places, right? India is also rolling out the digital health ID, especially for medical records, right? Which is fast, private, and easy to use. So where there was a time in India where people used to travel hours for circle, right? But now in current scenario, people can get various medical services and quality medical care even in their hotel. So that's the different strategy of these two different countries, right? So now let's compare them side by side. I have given some points, and on the basis of that point, we're gonna compare these two countries, right? So in context of technology, China has high-end AI and robots. So similarly in India, they have simple technologies and smart tools. In China, the technologies speed, the digital health speed and technology speed is centralized and that is super fast. Whereas in India, that is flexible and bottom up. China focuses in big cities hospital. India focuses, rural areas access. The strategy is government driven in China and the strategy is startup driven in India. The cost is higher. The healthcare cost is higher in China, whereas in India there is also affordable cost. So what does that tell us, right? So China is winning in speed and you can say infrastructure. Similarly, India is leading in resumes, lifetime, impact. But they are pushing global healthcare forward in a huge way. So why this matters globally? So here is the cool part that anything that is happening in Asia, that doesn't mean it is staying in only Asia, right? We can see many AI tools from the China that is being used in African hospitals, right? And many Indian health apps can be seen in Latin America. So and even Western countries are asking, can we learn from this? This isn't just about who wins, it's about everyone is winning together. So who is leading? China is leading in tech and skills. Similarly, India is leading in innovation and access, right? But the smartest move is learning from both of them. Now, here is the talk story. Are you more with Team China or Team India? If this video gave you a new perspective, then do like and don't forget to hit the subscribe button if you want to learn about leadership, healthcare innovations, and business strategies in the healthcare, right? To scale of your healthcare business. So thanks for watching this video and catch you next time. Take care. Bye bye.